Hawaii, like every other state across the nation, is searching for solutions to its homeless crisis. It's a complex issue that may worsen as the state's pandemic eviction moratorium is set to expire next month. With a new administration at the helm, Honolulu city officials are looking at a new strategy to help get people off the streets. Find out what's different about this approach and why advocates think it could work. Tonight's live broadcast and live stream of Insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Daryl Huff. The homeless are a diverse group of people ranging in age, race, health, and family circumstances, and their reasons for living on the streets or in shelters are just as varied. According to the 2020 point-in-time count, there were nearly 6,500 individuals across the state experiencing homelessness, with the majority on Oahu. These numbers are not exact and do not include people who may be on the brink of losing the roof over their heads. Any progress will require support from all levels of government and collaboration with communities. Tonight, we're asking our panel what needs to be done to end homelessness. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaii Facebook page. Now to our guests, who are back in studio tonight. Yay! Scott Murshige is the governor's coordinator on homelessness and serves as the point person for all homeless issues in the state. He holds a master's degree in social work from the UH Manoa. Anton Krucki is the executive director of the City and County of Honolulu's Office of Housing and Homelessness. Prior to this, he was the general manager of IBM Pacific and the president and CEO of Tissue Genesis, Inc. Connie Mitchell is the executive director of the Institute for Human Services, or IHS. The nonprofit provides a number of services, including serving 3 meals daily to anyone in need. And Chulan Sherbert Kwok is the founder and president of the Chinatown Business and Community Association. CBCA is a grassroots nonprofit that works with the city and other stakeholders to improve conditions for those who live, work, and shop in Chinatown. And I apologize for calling you Sherbert Kwok. Tell me, what's been the experience in Chinatown? It seems like it's been a real rocky road during this COVID situation with homelessness.
It's been very hard for everyone. And I think also very hard for the homeless because they are told to stay in place, and yet there aren't enough facilities to help them. And it made it worse for the merchants because they can't be moved. And so it's been like a double whammy for everyone to have to deal with it. Plus, our sanitation is difficult in Chinatown with our homeless, and there were more that came to Chinatown during these 2 years.
Why was that, do you think?
I think because they felt like Chinatown is more lenient, there's less enforcement, and people are used to seeing them come for 3 meals a day, and they hang around, and it became very entrenched, and it became the worst time for Chinatown this last 2 years.
Connie Mitchell from IHS, what's your take on what's been happening on the streets? It does feel like it's gotten worse, but I know that sometimes what we see is not exactly what's actually happening. So can you give me a sense of where?
Well, I think, over the last year and a half with the COVID pandemic and the shutdown, of everything, we didn't have as many people coming, from outside the state for a while. And then everyone was told to stay home. The only people that were left on the street were people who were homeless. So you saw a lot more of them because of that. And then now that we're opening up, that's going to change things. We already saw, an influx of people that are coming from elsewhere again. So I think sometimes it has to do with the governor's order to stay home. Sometimes it's been the fact that, when they haven't had anywhere to go and, they haven't had a place, to really call home, they end up being where they are.
You say, though, it sounds like you're saying they're more visible, but there are not necessarily more. What would you guess is going on with the numbers now?
Gee, and I think Scott would have a better idea, but I think there probably is an influx because there are, a higher number of people in general. But I just think that the two things put together make it feel a lot worse. But the other thing is that, there was another order by the Supreme Court that really tried to keep people out of jail for a while, and that really caused a lot of problems as well. So you saw a lot of people who were, committing crimes, but they weren't really being kept in the jail for any length of time.
Scott Murshige, the state homeless coordinator, she tossed to you on that number. So can you give us a sense, numbers-wise, what's going on out there?
Well, I think like what Connie said, homelessness I think clearly is more visible during the pandemic. I think the numbers, it's hard to have an exact estimate, right? Because homelessness is not a static thing, and you have people moving into and out of homelessness almost on a daily basis. I think downtown, and I work downtown at the state capitol. And part of what you see is people who used to stay indoors in places like the state library or other places where they would go for refuge during the day. They couldn't go to those places anymore. So you see people outdoors on the sidewalk, people who used to stay in some of the parks were moved out of the parks. So I think that makes it feel more visible. The one thing I want to note, though, is despite the pandemic, despite everything that was going on, our homeless service providers, they were on the front lines every day, and they were continuing to move people off the streets and into permanent housing despite everything going on. And when you look at our numbers statewide, the percentage of people moving out of the homeless system into permanent housing, that number has stayed above 50% despite everything going on with the pandemic. And we've had partnerships with groups like IHS, Partners in Care, going out, not only helping to get people into housing despite everything going on, but also making sure they can get access to testing, vaccination, and so forth. So I think that's something that we need to keep in mind as well, is that the work never stopped despite everything else we saw going on in the road.
Let me ask, so to follow up on what Connie was saying, are you seeing people coming from the mainland again? And then what's behind that? Maybe the same thing that's always been behind it.
Yeah, I think, there's this, what I think is a little bit of an urban myth of other states or other cities who send people to Hawaii. And I've not really seen that in the 20 years I've been doing this work. But I think what happens is a lot of people have this vision of Hawaii as, the paradise, right? And there's people who come here with a hope of finding a job right away. Some people think they may be able to just live off the beach. And they come here and they experience the reality. And then many of them, want to go back home where they came from. And I think we're starting to see, as things are opening up and we see more tourists coming here, people who have that idyllic vision of Hawaii, I think, are starting to come here more frequently too. I think, again, though, when you look at just the majority of people we know who are experiencing homelessness, the vast majority are people who are local, who are born and raised here. And I think we have to remain focused just on helping people get out of the situation of homelessness, no matter where they originated from.
Anton Krookie, you're the newcomer to this issue to a certain extent with your appointment. You were previously an executive. What's been your impression as you've been walking into this issue about what are the main drivers here and the current conditions?
It's a very complex problem, right? And as my colleagues would say, and we work together all the time, really, and we really do collaborate. But the real situation that I see is that the laws restrict what we can do. So the person on the street, really, their ability to, we offer them services, we offer them help, we offer them treatment, or nothing, right? They can choose nothing. And then there they are, right? And it's very difficult to deal with that situation. So my analysis is that decision making, I have to create more and different decision making. I have to push scenarios so a person would be urged to make another decision, right? Look at what they're doing on the street. Is it a crime? And maybe they've given up some of the civil liberties. Change the decision. And then once you look at multiple ways you can get that decision to be different and not just be locked into that one, then you want to look at all of your resources. Could I react to those decisions? If I can improve those decisions, do I have the resources? So we analyze that, whether it be stabilization beds, whether it be shelters, whether it be transitional housing or housing capabilities. And I tell you, if I had the best Christmas ever and everybody on the street raised their hand and said, look, I'm ready to go into a shelter, a bed, or a house, I don't think I'd have them ready for them. And we've got to work on that.
It might be a little unfair for us to put you too much on the spot. You've been in the job, 7 months maybe?
7 months.
But those added levers or stuff. Is it working? Are you seeing progress, or are you guys still in the process of building your strategy?
Well, we're in the process of both building and in the process of deploying. So you asked about Chinatown earlier. And so in Chinatown, we have a multiple set of outreach programs that we've really been intense in working the streets, but also getting the word out on the street that things are going to be different. They're going to be managed different. Now, these aren't necessarily homeless problems, right? I think a homeless solution is something that would treat somebody or would result in a shelter, result in a housing, right? But you also have to manage your streets because that's where many of the homeless are. So we've upped the patrols in Chinatown. We took CARES money, right, and we've upped the patrols, so we have more foot patrols. And Prosecutor Alm has started Weed and Seed. And so Anthology has been doing the survey so we could see what the community really wanted. And then we'll do annual surveys to see if we're moving along the direction that the community wants. We can't just listen to the loudest voices, right? But then we're going to be able to pick people up and then either prosecute them or get them into treatment.
Let me ask Chulan, have you seen results from this added emphasis in Chinatown?
We're very hopeful with this new program because Chinatown has been in decline for over 20 years because it's been such a place where politically it wasn't important enough for action or investment in Chinatown. But in the last few years, with WOFAC coming on board with a new hotel and several other buildings coming up, there's been some interest in cleaning up Chinatown more, and this administration actually are going to do it. So it has given the people a lot of hope, and we want to wish them success, and we are helping them.
Well, you've already got some added police patrols.
Yeah,
I think the
increasing.
people kind of expect a quick result from that. Have you seen a quick
No
result?
quick result because we're using overtime police officers, and they're limited by the number of hours they can work overtime, and we are still short of police officers. So whoever we can get that patrol, we're grateful. So I think just the mere fact that you see a body walking around, that gives people some faith and some trust that, hey, we got to get behind this administration and help because they are doing all they can. We can't just change it overnight. It took 20 years to be where we are. So it's going to take some
I think there's a
while.
threshold to cross, though.
Yeah.
And so once we can take some of the people off the street that are very visible, and we can talk later about programs for that once you reach a certain threshold, the community themselves talk to each other. And they may find it's not where they want to be, right, on the street late at night where they thought before it was. And so we're going to have to give it a little time to get at that threshold, but that's what we're looking to do.
Connie, when you hear about law enforcement in particular being part of the strategy, how do you feel about that? Are you comfortable with that? And do you see this as being a positive step?
I definitely think it's a plus. And the reason is because homeless people themselves are victims a lot of the time. And also there's a lot of drug dealing that goes on that also affects the people who are homeless. So I think if we can really separate, as Anton was saying, the criminal element, you're going to have a lot easier time talking to somebody who is not quite as drug addicted or not quite as traumatized by some of the stuff that's happening.
Scott, let me ask you, this is a question that's coming from Carla via Facebook. What are the percentages of the homeless, mental health, drug addicts, families struggling? Can you give us a sense? I know that you might not have specific numbers, but generally speaking, frankly, one of the things that I feel like, because we covered the ICE epidemic 20 years ago, it never went away, and it strikes me that many of those people are perhaps psychotic because of their basically career of drug use, and that must be a very difficult group. But in answer to Carla's question, what would you say? How much of it is mental health? How much of it is addiction? How much of it is families struggling with the economy?
So let me say this. I think we've really been working together, state, many of the people here for the past several years. And I think particularly with homeless families, we've made a lot of progress prior to the pandemic. I think that number went down statewide by over 40%. It was a significant decline. And I think it was because of investment in programs like HAWAIʻI Village and in other kind of programs that really emphasize permanent housing for that demographic. Now, when you talk about people who are dealing with severe mental illness or substance use disorders. Generally, in the point-in-time count, it's between 25 to 30%, roughly, and we all know that's potential undercount, and it's largely self-report, right? But I think it gives at least a general idea what segment of the population that is. I think the challenge is, although it's not the majority by any means, the people who are really dealing with severe mental illness, a lot of them are not able to make the choice to accept treatment on their own, right? Going to, I think, Anton's point, it's very difficult. We can't mandate somebody to accept services. We can't mandate somebody to accept treatment. But so we've been working on things like Connie's organization is working on assisted community treatment. How do you get people connected to possibly orders for treatment if they're not able to consent on their own? We've been building out some of our mental health resources. I think one of the things that has the potential to help in Chinatown and other areas is the expansion of the Hawaii State Hospital. And I think we're really grateful for the leadership of Department of Health and the legislature for providing the funding to facilitate that. And just this year, we've actually seen people go non-forensic, non-criminal cases going into the state hospital for the first time in a long time. So I think that's a positive sign that we're starting to build out that infrastructure to really provide more options, for people dealing with severe mental illness.
Connie, what is your read on that proportion? And also, are you starting to see progress in dealing with the severely mentally ill and the chronic drug addicts?
So on the first question, I think, Scott's right. It runs about 20, 30%, but the fact is that that's all the homeless people. That's not all the ones that Chulan sees in Chinatown. When you look at the people who are unsheltered, the number of people who are either drug addicted or mentally ill is way higher. It's upwards of 70, 80%, of the people, because you really see people who are drug addicted or drug affected. And I think, as was mentioned before, when you've been on methamphetamine for a long time, I remember when I was at the hospital as the director of nursing, I thought to myself, well, I see all these people coming in, and they're coming in on these forensic orders. They look like they're mentally ill, but it's because they've been using meth. And I thought, wow, 15 years from now, I wonder what that's going to look like. Well, we see what that's going to look like right now.
Anton Kricke from the city and county. So that's a kind of a striking number, right? The unsheltered people, and those are the ones that people complain about, and those are the ones that are going to be the most difficult. You mentioned all these little levers and stuff, but in terms of resources, one of the other questions that came in is, I noticed this visiting Seattle not long ago, not only in Hawaii, all over the U.S., the same problem. Look at Seattle, which is worse. I don't know if it's worse. Why is it never solved by government? No power, no money, no idea. Are the resources there? Do you believe the resources are there to deal with that particular population, the on the street, mentally ill or drug addicted population, which is a very big part of that population?
So in looking at that lever, right, and to try to make a nick, and I don't know if you can take that whole group and move it quickly, but the city's going to tee up a new program called CORE, which is Crisis Outreach, Response, and Engagement. And the cities that have done this, it's been quite successful. The concept is it's a diverted 911 call that HPD would normally respond to. And an HPD response can lead to different kinds of responses, right? It's a uniform. The person might have had other experiences with that uniform. Plus, their general mode is to make sure that the situation is under control. What CORE will do is we'll have individuals with both mental health, medical, and provider backgrounds to do some of those calls. Some of them may be blended with police until the situation is safe, right? But we're going to headquarter down in Iwilei, and we have the 2 trucks already being painted, and we're beginning to hire. And we're hoping by September we'll be out on the streets with these new branded trucks. Now, when somebody approaches somebody on that decision, the first time may not yield results, but it's again and again. And if they get to know the person and they get to know them and trust them, maybe in that one point of crisis, there's an aha moment, right? And we want to be able to seize that moment and get them to treatment. And so we're also with the program going to have beds available all the time. We're going to contract out so that if we get one of those moments, we'll have a place to take someone.
Connie, let me ask you, are you involved also in this program? Those are your people?
No, it's not my people, but we were participating in the planning of it, because I think when Anton had brought a lot of people together in the homeless service sector, including some people who had been homeless before, I think the we came up with a consensus, that would be helpful. We have different types of outreach going on right now, and we do, like, I have a team that does mental health, and Scott was mentioning the one that the city funds. It's really to help people who need that court order for treatment. So we've done, some work in Chinatown, pulling some people off the street that way, and really doing it in actually multiple ways. One is, before we even get to the court order, we get, really assertive treatment, by going back over and over, like Anton was saying. And then some people say, okay, I'll take the shot, or I'll take the medication. So we got some of those, and then the other people, we find their families, and if the families are willing to, do a guardianship, they're able to at least consent for the person, because they can't really, make a good decision the way that they are. And then finally, if that doesn't work and nobody's around to actually be the guardian, we're willing to go to court to get an assisted community treatment order, which is a court order for treatment.
So give me a sense of how long this takes with these individuals, and how many people do you have to put on one person to get to that point, to get them treated?
Well, I think in the last year and a half or so that we've been doing it, it's been slow, admittedly. But I think we changed the law this last legislative session. I think it'll go a lot faster, because before the public defenders were involved, and there wasn't like a guardian ad litem automatically appointed, but now that's going to happen.
Oh, that's right. I remember now. That looked like it was going to die, and all got saved at the last minute. And so that is something that's usable, right?
Right.
Anton, are you folks actually using that as a tool, or do you have to hand it off to another agency when it comes time to getting a court order?
We wouldn't directly use as a tool. Like Connie would be doing that. She'd be petitioning, taking to the court. Prosecutor's office would do that. But we'll be involved in trying to do funding, if you will, to help support that program. Maybe give the judges budgets for the guardian ad litem, work with Scott on those kind of things so that there's a budget to execute it. So we'll all work together on that.
Shulon, your observation, what's the population in Chinatown, you would guess, in terms of, we're talking about drug addicts versus mentally ill?
Easily 200 plus on our streets, and I would say 60% are involved with drugs and criminal, and some are lifestyle, hardcore, and they've been on our streets for like 10, 15 years. They won't change. And so some of our programs are too pampering. They're not helping these folks. So recently, the Houston mayor came up with a tough love program where our city is also doing with our mayor, Rick, is to cite them for violation of law, possession, sit and lie, right? And also property obstruction. These are existing laws that need to be enforced. And that would take away this element of obstruction and I own the street and you don't, you have to go onto the road. I mean, we have a democracy where it's majority rules, but we have been bending backwards for the minority, for civil liberties, and yet we don't have solution. ACLU hasn't come up with a solution to help the majority of the people. We are suffering. So this action now, where you're going to enforce the law and at the same time give them a carrot and say, hey, you got a choice. You have a warrant against you. You're going to go to jail or you're going to go in treatment.
Let me ask Scott Murshige, do we have the resources ready to take in a bunch of people who are come through the criminal justice system, as Shulon is describing, and give them these options? Or are you going to see individuals getting cited and arrested over and over again, but then just cycled back out in the system? Are you ready for that?
So like I said, I think we've done a lot of work over the past several years on building out our infrastructure for our mental health system and our substance use treatment system. I think one of the innovations that actually came out of the pandemic is this concept of stabilization beds. And I think it really started at the beginning of the pandemic. We had a facility, the Temporary Quarantine and Isolation Center, Ivalea. We're seeing a lot of homeless people come in for quarantine and isolation, but many of them had co-occurring disorders. And Department of Health realized that if you're able to provide these beds for stability and support, that really helps improve outcomes for these folks over time. So we've started to slowly build out, expand the number of stabilization beds. We have some the campus of the Hawaii State Hospital. There's modular homes that were built on that campus. We have some in Waikiki at one of the hotels that were converted over there. And I think we're looking at expanding stabilization beds in other parts of the state. Because again, this issue, it's not one that's just on Oahu. This is something we have to think about statewide.
Connie, you wanted to say?
Yeah, I just wanted to jump in and say that another thing that's happened is the use of Act 27. And that's really, if somebody, gets picked up, like what Chulan was talking about, they actually, if it's a petty misdemeanor and they look like they're mentally ill, it's actually a way to get them treatment, because they can get taken to the state hospital and actually evaluated there now. So they would hold them for about 7 days, and then if they feel like this person really needs treatment, they could actually civilly commit them at that time.
So that's happening now?
Yes.
Starting to.
Yeah.
So let me understand, because that sounds very, very significant to me, because, we've heard about the quote unquote revolving door all the time. Tell me a little bit, again, how this works. Who decides that person who's getting arrested for a petty misdemeanor, say defecating or, swearing or yelling or something that doesn't hurt someone, how do you hold them, and who decides that they can be held and where?
So if they get arrested for a petty misdemeanor, they're going to show up in court, right? And so the judge, can at that time decide, to send them to the state hospital to actually get evaluated instead of sending them to jail. So if the person really truly, has a mental disorder, that is a way to, ferret that out and give them some treatment.
So, but just so again, so you take this person to jail within next morning, usually they would be in court very quickly.
Right.
Then who is in court though? Is it just the judge looks at the person and goes, I think you're mentally ill, and boom? Or is it take a witness, or what kind of defense does that person have?
So I think it depends, on who has interest, in the person actually getting the treatment. So for us, a lot of our outreach workers or our case managers, if we know the person got arrested, then we'd be in court, that next day, advocating for the person to actually go and get evaluated.
Wow, Anton Kraki, what do you have you been watching this process, and is it something where if we went down to court, we would see this happening?
I think that, especially like the morale in HPD, this is a very positive thing. They can see a result. While the prisons were locked down, they would arrest somebody and they'd see the person on the street before they filled out their paperwork.
And it was people who were hurting other
terrible,
people too.
right?
It wasn't just.
And so in the
status
court
offenses.
also, besides the caseworker, family members can come. A lot of folks that are mentally ill and such, they've been detached from their families. The families would like to help them, but can't help them, right? And so all of those things get involved in that process. But I really think that we need to check on those resources to support it, so that in that process, if then they're going to go to treatment, we have the resources. And we spend time mapping that out. And it's not just mental health resources or drug rehabilitation, but places to put other people that want to be housed, transitional houses, villages, those kind of things. And I think you're going to see a lot of building of that in the next 2 or 3 years, because there's funding for that.
Scott, do we have the resources to take this kind of flow? It has the potential to be a lot of people.
So I think, like, others have said, we're starting to build that out. And, that act that Connie mentioned, I think that came out of a summit that really brought together Judiciary, Department of Health, a lot of players to make that happen. I think in terms of the villages and some of these other options that Anton's referencing, I think we're at a moment in time right now where we have a significant, unprecedented level of federal resources coming into our community. The American Rescue Plan Act, and other federal funding streams, where I think we really do have an opportunity to take that funding. A lot of it can be used for capital infrastructure as well as for additional mental health or other social services, and figure out how can we use that to really expand our capacity. And we've been taking proactive steps to really look at that. One of the things, Anton and I talk at least once a week, and some of that is the state looking at, well, what kind of underutilized lands do we have that we can maybe partner with the city can put in the resources for the infrastructure, and we can use some of this federal funding to really bring some of these things, start to scale some of the things that we know work, that we know can really be effective.
You're getting a lot of questions, so let me get to some of these. This was kind of right off of what you were talking about, Scott, and either Scott or Anton or Connie. Why not have more transitional housing that are manned by medical, mental health, employment, and permanent housing personnel to assist the homeless? That's a question from Jody via Facebook. You've been looking at the system. What is sounds like a good idea.
It is a good idea, and you'll be seeing that. I think that, the big push from the government in the last few years has been that they call Housing Now. And what that means is that they
Housing
really,
first, right?
people wouldn't go into shelters because they couldn't, there's too many rules in shelters, right? And so what you're going to do is you're going to house them, put them in a house, and surround them with services, right? Well, there's a lot of data that says that's very effective, but that's not the whole solution. And I believe that these 2-year living in these villages is a way to go. It builds a sense of community of those individuals, so when they go out, they can function better. And then you have all the service providers in there. We have some villages operating today that Connie is a service provider that's in there that can bring those services there. You also do job training there, right? You do childcare there, and you get people jobs there. And then that's how you get them on the way while you have them in these transitional communities.
Is there a room right now, or are they all full?
They're pretty full. But we're going to build some more.
Do you sometimes feel like if they build them, they're going to build them in my neighborhood? Is that your...
We're not worried about NIMBY. I think it's just like you have to take everything into consideration. That's like if you place a treatment center in the middle of a lot of residential, that's not going to work because the community is not comfortable. So I think we like the idea of having Iwilei as a campus for homeless services, where we already have several very good city buildings, new, first-class facility for them. They can walk between Salvation Army, Catholic Chariot, and I think it's wonderful. And they feel like they're seeing their own kind of people going through the struggle. And so I think if we clean up the campus over there, it's nice. It's within walking distance to everywhere. And I also think that the new city prosecutor program to bring weed and seed back to Chinatown is very important because that combines with law enforcement and then works with the courts, with a prosecutor's office, county nonprofit, the state. And I think you need a whole arsenal of tools to really help because it's too complex and we cannot give up. We have to give them tough love. We also have to enforce the law.
So this is a question from Tim in Kaimuki. Will Waikiki also get the same programs help? St. Augustine and Waikiki has been broken into twice in the past 9 months. Scott Murshige, is there, when we talk about these places, a lot of times the geography matters, right? And so is there something coming for Waikiki that's something like Chinatown? And will there be, near Waikiki, you're talking about some pretty, neighborhoods that probably wouldn't appreciate having intensive homeless services there.
Well, I think right now, like I mentioned earlier, we have stabilization beds right in Waikiki. And actually, when they had that conversation with the neighborhood board was actually very supportive. There's other city properties. There's one at Enna Road where they take people in off the streets, provide them housing. And one of the things that we've been doing in Waikiki specifically actually is working with Connie's organization, with some of the other providers, Hawaii Health and Harm Reduction Center, and partnering with the Waikiki Business Improvement District Association to try and really have partnership between the social service providers and the business community. So we started that, I believe, in February of this year, and they formed a homeless provider hui in that district that's starting now to meet on a regular basis. And just through that process, they're really figuring out how they can better streamline services, really target some of the individuals that they're seeing in that community.
And I think I want to add that in Waikiki, we do have that district as one of our outreach areas. We know that the homeless in Waikiki are a little bit different. We have a lot of people that are really not from Hawaii there, because they're visiting and they want to go to Waikiki. And so we are partnering with the Waikiki Business Improvement District, to just really look at their ambassadors who know a lot of the people, because they walk the streets a lot of the time, working with our outreach people. And then we also partner with HPD to do, outreach also. So I think the collaborations have made a difference, and it helps everybody know better what's going on with all these different people.
And interestingly enough, in Waikiki, they did their own point in time count last month. And so COVID didn't let us do a point in time count. And that's where you count both the sheltered and unsheltered homeless.
Usually
Waikiki did
January, February of each year, right? Yeah.
Their point in time count this year was down.
Well, but I mean, did they do it better?
Well, but it's the same. Yeah, they're using the same method and everything else, but it's not an explosion. You know, that you would think would be the case. I was surprised by that, but that's
You know,
what
one
happened.
observation, just my own observation, it seems like during the pandemic, when there weren't so many tourists in Waikiki, it felt like a lot of people went to Waikiki because it was kind of, I won't say homeless friendly, but it was not as, there weren't as many people there, so it was a more comfortable place to go and hang out, and that might have dissipated back out again into the other communities.
Well, the
Waikiki and-
Business Association in Chinatown would tell you that a lot of the people from Waikiki migrated to Chinatown because they couldn't panhandle. There weren't the tourists there to panhandle with, so they moved to Chinatown. So you've got some of that kind
No
of thing going
economic
on.
base, okay. But this kind of goes to that question, a question from Marco in Makiki. There's a lot of homeless people on Punch Bowl Mountain, but police say they can't do anything because it's federal land. The question is, who can people call to report issues? But this issue of federal land, state land, city land, private land, it just comes up over and over again. You know, and I'd kind of like to know, are we getting better at that? Scott?
Well, I think we are getting better. I mean, I think when people talk about coordination, it's not just us saying it. I think even, you know, some of the things we've talked about tonight, right? Like the police being part of the solution in addressing homelessness. That's not something that we would have talked about maybe like 5-6 years ago.
Well, a lot of
right?
advocates
So-
would have been against it.
Yeah, so we have different people at the table now really being part of the answer. I think it is frustrating to have these jurisdictional challenges, whether it's federal, city, state, private land. But if, you know, Marco is wondering where you can call, I would say one of the places you can call is, you know, my office. We try to be a resource to the community. We have a, you know, a helpline. It's 808-586-0193. You can also email us, gov.homelessness@hawaii.gov. And my staff, I have a great team. When these calls come in, we can help you determine whose jurisdiction it is, right? Because the average person is not going to know. We work with our congressional delegation, with other state agencies, with city agencies, so we can figure out how to work towards a solution. And we also can engage the providers. And a lot of times through that process, we've been able to connect people who otherwise, you know, would never have been connected to anything, and really are able to start to see a little bit more progress in moving them to something where they can be in a stable, safe environment and really connected to the support that they need. So I think things are getting better, or getting more coordinated. We have more people working together actively, many more different parties at the table. But, you know, it continues to be a work in progress.
Anton Crookie, if this question of who you're going to call, right? I mean, can they call, if they call the city, are they going to get the same kind of thing, or are you kicking them over to
No,
them,
if they
or-
call the city, then we're going to do the same kind of analysis that Scott does. We're kind of partners in this. And then a lot of times what we'll do is we'll coordinate, so city and state will go out together at the same time to kind of cover those bases. We'll also go after and try to understand if there's private landowners and if we can get them on board to, and so sort of catch all these bases that we can at the same time. But, you know, the individuals they understand these rules really well too. I mean, we go out, we find that their things have just moved onto the DOT property, right?
Yeah.
Or they go out and it's just moved into the city park, and so we have to be as smart as that as well.
A couple more questions coming in. First off, let me ask Connie, in the 20 years or so you've been engaged in this?
15.
15, sorry. But, I mean, your agency certainly for much longer.
Yes.
You know, and is this the best we've done? I mean, in terms of all of this coordination, or do you really feel like we've sort of turned a corner on this ability to?
I really
think this through?
do. I think that's been the best thing about COVID, is that it just forced us to really coordinate, you know, across, you know, everyone, you know, like the government, the service providers, the general public, and just really come together around a lot of things. I think in the past, you know, there was just too much, you know, well, I'm doing this, and, you know, they didn't want a partner or something like that. But I think, you know, we've really been able to break down some of those silos and be able to, you know, really not duplicate services as much. I've always, for the whole 15 years I've been in this position, I've always looked for ways for us to not do that. And the other thing is to just really try to, standardize some of the ways that we're doing it. Like, you know, one group, they might do it one way, the outreach, or, you know, you do this. But I think to say, okay, We all believe, in these basic principles. We're going to meet them where they're at and really assess, whether they're ready, to do something. Like Anton says, some people are not ready. And then also to go back more frequently, so that it's not like, or if you say no this one time, I'm not going to come back to you. But in fact, to keep going back. So I think if we can do more of that, we'll have much more effective services as well.
Yeah, Connie mentioned earlier that when I was talking about the CORE program, that she was on the committee, helped design it. I think it was really a significant event. So I had the city departments there, and we would have designed it a certain way. But then we had two members of the state at the table. So you had homeless and behavioral health at a city table helping design a city program, right? Then we had providers, and we also had homeless. And so bringing people together like that wasn't difficult. I mean, we already were together talking all the time. I make the invitations, they all show up. And I think that's different than it was before.
Well, it's easy to call a meeting, but it might not be easy to get people to listen to each other and change.
Yeah. Well, I thought the collaboration was very good. Everybody was very open to each other, especially having the homeless there that could really talk about what's the best way to approach somebody. That was significant.
Just really quickly, did the CARES Act and the help from the federal government, was there significant money that came into the state to deal with this, Scott?
So a lot of the money that came in for homelessness for Oahu in particular actually went directly to the city and county, and the state manages allocation for neighbor islands. But I think it was a significant amount of resources, and one of the things that came out of it is Partners in Care actually has this program called Oahu Housing now. It's a $10 million grant from the city and county, and they've actually been able to house, I want to say, close to 150 households just within the past 3 or 4 months. I think that's pretty significant, and they're housing them in a very rapid rate. So I think that just is one example of how this infusion of federal funding can really go a long way. And there's even more resources coming down the pipeline with emergency housing vouchers and also funding for what they call the Home Investment Partnership Program, which can help with capital costs.
Let me ask Scott, this is a question from Jenny on Kauai. Are the panelists only discussing the situation and programs on Oahu? Could it be clarified? What's the statewide plan? And can you give me a quick rundown of how you feel that is happening on the neighbor islands?
So the collaboration, I've talked about, it's not happening just on Oahu. I have regular calls with the homeless coordinators from each county. So each county has a counterpart of mine. We meet regularly. And on Kauai, actually, one of the great things that happened is in November, we opened Ohana Zone project on Kauai, Kealaula at Pualoke, which provided additional permanent housing units to get over, I believe it's 28 households off the street, all families with young children, into permanent housing. There was another partnership where the Kauai Police Department actually provided some funding for housing vouchers for people transitioning out of the permanent camping that they had open during the pandemic on Kauai. And we're seeing the same thing happen in every other county. So in Maui in April, we opened a permanent housing project, Huliao, where they converted the former Maui dorms in Kahului and created permanent housing. On Hawaii Island, we have projects in East and West Hawaii that provided tiny home shelters, Halahanakahi in Hilo, Kalamaku in Kona. And I think the idea is bringing the community together, really figuring out what works best for each community, and then keep the focus on, well, how do we get people transition to a permanent stable place? How do we create different pathways for people to get off our beaches, get off the streets into permanent housing? And we see that happening in all the different parts of our state.
Connie, you I'm sure you're in communication with other service providers across the state. Do you think that they share your sense that there's traction finally on these issues around the state?
I think they've had some traction going for a while already. And most recently, we've been partnering and consulting with Big Island Hope Services and just sharing with them some of the ways that we've been engaging the health sector in just really paying for a lot of the case management and really helping them to build their capacity also. So I think, we're definitely doing a lot of different kinds of things that, we haven't been able to do before.
I've got quite a number of questions. I think I've got 3 or 4 questions that have to do with land costs, housing costs. Diane from Wahiawa, the effects of speculation, real estate affect the homeless issue. How can this be addressed or fixed? How is the city and state government getting prepared for the end of the eviction moratorium? That's kind of via Facebook. what about the homeless who are not mentally ill, the ones who are living paycheck to paycheck? Welfare didn't come in, or they are physically unfit to work and pay bills. Do we have an economic? Is there worry that we're about to hit another economic cliff when you start talking about this? Anton Kroenke, what do you see the future being of these kinds of issues? At the city level, you guys do have some ability to control housing costs, if not the prices.
Well, there were two major issues in there. One was
Sure.
the eviction moratorium, and then the affordable housing, availability and affordable housing. The city, we analyzed that, and I would say for the projections, if separate of the eviction moratorium, the projections for the need for affordable housing versus what we have online, the need exceeds what we have online. And when you have when you look at affordable housing and you talk about, they use the AMI, the average median income, as one of those things. Some of those numbers are actually quite significant. A person has a nice job, they're making $80,000 a year, but they need affordable housing, right? That's what makes it tough. We're doing different things. We passed a bill earlier this year already where we'll give a grant to developers when develop affordable housing, right? When we had the bill H201 that allowed certain permit allocations, right? We had 2 projects in the last 2 years that went through on that bill. Since we passed the granting for each unit for affordable housing, we have 9 projects in permitting now. Right, and so we're looking at those. We're looking at everything from micro homes, right? If we could, in a small plot, build a lot of homes that would have, no parking, people would be in an urban setting, things like that. But, some of the projects have gotten away from us, over time, where we thought there'd be a lot of affordable housing, but we didn't make it long enough. So now we're also looking, and it needs to be 60 years, right, and stay in that state for a while. So all of those things we're looking at. The drill coming up in the 1st of August, and I think Scott can talk about it well, we have to prepare for that. I mean, there are mediations that have now been mandated, and we have to get people informed so that they sign up for the mediation. But there are going to be a lot of different situations in that. And I'll kind of turn it over to Scott to talk about it.
Yeah, no, definitely. I think we're all very concerned about August 6th when the eviction moratorium lifts. And what we've been doing is really trying to get the word out there that, one, the law has changed. The legislature passed Act 57, which incentivized landlords to go into mediation. It makes some changes to the landlord-tenant code to give some people more time, and people need to be aware of that. If you're a tenant or if you're a landlord, the notice time for evictions for past due rent has changed. It's increased from 5 to 15 days. The notices have to include a right to mediation. And I think most significantly, within the first 30 days following the end of the eviction moratorium, the courts can only take cases for eviction for summary possession for people who owe 4 months or more of back rent. And we want people to know what their rights are, that they have that right to mediation, but most importantly, that we have significant amounts of federal resources still available in the community in each county to really help people not only with the back rent, but if people do have to relocate, they can pay rent forward for a new unit.
Well, let me understand something. So I'm a tenant. I've got behind on my rent. My landlord, for whatever reason, decides he doesn't want me around as a tenant anymore. Up until now, for economic reasons, they haven't been able to evict me. So what you're saying is I would get a notice from my landlord. I'm required to get a notice from my landlord that lists all of these things, and it can't just be for missing 1 month. It's got to be missing 4 months, for example.
For within the first 30 days. But I think the most important thing is knowing that you have a right to mediation, and mediation gives you time to work out some of these details with your landlord. It gives people time to apply for the federal assistance that's out there. So I would encourage people on Oahu who are having problems with their rent, if you haven't applied yet, you can go to the city's website, to oneoahu.org/renthelp, and the Office of Economic Revitalization has really done a great job in running that program. I think their portal is currently still closed, but if you go to that website, you can sign up and get a reminder when it reopens again, which we expect it will soon. And on every island, there's similar rental assistance programs available for those in need in the community.
And part of mediation is that they're probably going to let them know that you can apply for this assistance, so that if they didn't know before, they can still apply. And I really feel for a lot of the landlords, who really have been without the payments for their rental, and that really makes the person whole, the landlord whole, and then it also gives the renter,
And we're funding that
opportunities to-
mediation, so it
Yeah.
won't cost the tenant anything.
That's
So
right.
Or
we
the
should build into
landlord.
it, Yes.
Yeah.
Yeah.
Because landlords would be more nervous about that. Let me go back a little bit, though, to affordable housing, because I know Chulan Shipper Kwok, you were quite involved in having to advocate for an affordable elderly housing in Chinatown, which took years and years to
Yes.
get approved. I mean,
Thank you, City.
do you feel like they're any better now at moving along affordable housing projects?
I think because of the rail coming in, so the area around the rail where they can get special credit and also exceptions, and so I think
You mean the
this has
incentives to build
yes.
affordable?
Yeah, Todd has really brought on a lot of ambition, and in China alone, right across from Oahu Market, they're going to be like 400 units, because we have 200 some units coming up. They are micro units, no parking, and then next to it is a possible hotel coming up, and then we already have like 30 some units in Manuka Marketplace, where businesses were not upstairs, so it got converted to affordable housing. It's fully occupied. And Hali Waiolu, River and Vineyard, 156 units. And Alakia and Baritania, Queen Emma there, we have like 3 buildings coming up. So we're very excited with all of these affordable housing, anywhere from like 30, 40, 50, 60 AMI.
Connie Mitchell, again, I keep coming back to you for the length of time that your agency has been involved. Do you see the planets kind of aligning here? I remember this is a question that came from Stephen Kakako specifically about veterans. And I remember early in the crisis, there was this promise to end veterans' homelessness by X date.
Right.
Did we do that? And does that show that sometimes the best intentions are just so difficult?
Well, I think what we do know is that when we talk about ending homelessness, it's about what we call functional zero, which is basically if we always know people are going to fall into homelessness, but if we can quickly get that person out of homelessness back into housing, that's the key, so that we never have a growing, burgeoning number of people that are homeless. So as far as veterans concerned, yes, we have made a considerable progress with that particular group, because I think in as much as there are more people that do love to come back to Hawaii, people have served here, they want to be here. The federal government has a lot of resources through the VA to help with housing. And isn't that one of the groups, Scott, that has done really well in terms of reducing homelessness?
Yeah, no, I think that they've made a lot of progress, and we really are getting, again, some of the sickest veterans off the street, people who served our country. So I think we made progress in a lot of areas, but we're still bumping up against some barriers. So not only affordable housing, but I think one of the challenges is when people receive housing assistance or receive a Section 8 voucher, there's many people who still run into barriers where you look at just any ad for rental housing, it'll say no Section 8, no vouchers. So that's another thing I think the administration is looking at. Well, can we potentially change that? Last session, Governor Ige introduced a bill to try and address discrimination against Section 8 voucher holders, is what they call source of income discrimination. We've been working with a group of different advocates to try and continue working at legislation. We're looking at potentially reintroducing it for next session. But we need to look at barriers like that, some of the systemic things that are making it challenging for us to continue getting people into housing.
Let me give, I'm going to give Anton Crookie, the newbie on the street here, although you seem to have jumped into that learning curve pretty vigorously. We're almost done here. Can you just give us a sense of how different it will look in 2 or 3 or 4 years, or how long do you think it's actually going to take till we're at what Connie described as functional zero?
Well, I think, first off, we're down to a by-name list for veterans. There's 282 on the list, so that makes it workable just for that situation. But, if I could look out 3 years from where we started and what I saw, I think right now our providers are getting strong, but they're driven by their funding, and it's all by a federal funding. And now that a lot of money's coming into the city and the state, we can start to look creatively. How do we do this for the state, not just the way the feds want us to do it? So we can deal with chronic homelessness, we can deal with people who are motivated to be in homes. And so I see us looking at it a bit differently, and I also don't I really feel if we can get the providers to a place where they're not just working for themselves, because if all I get is paid to do this one thing and I want to do, I don't see the picture. And so I think our kind of job, Scott and mine especially, is to connect these pictures together so that they're motivated to be together. And that's where we can take funding and help them do that, because they have to stay alive, they have to hire their people, they have to be functional. So we can understand that, and then we can help them bring it together, because I think connecting those dots is what a term we use a lot, can give us the leverage we need.
Okay, you have 15 seconds to tell me how long it's going to be till we're at functional zero.
Well, functional zero for the vets is by the end of next year, not this year. That's the goal for the veterans.
For the rest of the population.
Rest of the population, I don't know if that could happen. I would like to take a big chunk of that. I would also like to be able to parade a bunch of people that we've helped turn around their lives and be better in the community.
Very good. Thank you very much. And mahalo to all of you for joining us tonight. And we thank our guests, State Homeless Coordinator Scott Murshige, Connie Mitchell, Executive Director of the Institute for Human Services, Anton Krucke, the Executive Director of the City and County of Honolulu's Office of Housing and Homelessness, and Chulan Schubert Kwok with the Chinatown Business and Community Association. Next week on Insights, the University of Hawaii had to find a place for its football team to play after Aloha Stadium banned fans. So the school is renovating its on-campus athletic complex to host Division I football. We'll hear from school officials and community members ahead of the Rainbow Warriors season opening in Manoa. Please join us then. I'm Daryl Huff for Insights on PBS Hawaii. Aloha.